Hello everybody, I'm Dr. Parul and today I'm going to talk about retinoids in skincare. Retinoids are vitamin A derivatives and these are one of the most active ingredients which are available in the medical skincare product range. I call it as a wonder drug because it has varied applications and it can be used in correcting many of the skin conditions and along with that giving you boost to build up and improve the quality and the texture of the skins. But it has to be used with a cautious and it has to be always under a doctor's guidance. Where do we use this retinoid? Now, retinoids basically are available in many concentrations and many formulations. So, it is retinol ester, which is of a low potency. Then you have retinol, which you get in the form of solutions, which is a potent form. Then you have retinaldehyde, which is again a potent form and which you get in many of these big brands with night creams labeled as an anti-aging product. They have the retinaldehyde, and then you have the retinoic acid, which we use in acne because it's a super potent part of the retinoid. So where do we use them? First is, like I said, acne. It reduces the oil secretion of the gland, it reduces the production of the sebum, it reduces and flakes off a lot of blocked pores in the acne and shrinks the acne. That's what we want, right? So like I said, the retinoic acid, this part which is used in acne, is a prescription drug. It is going to come to you with whole lot of instructions from the doctor in the form of dryness and flaking observed. So you have to use a moisturizer, you have to use a sunscreen, and it is only supposed to be used on the spot application, that is only on the acne, as it is a very highly concentrated and a super potent one. Second, it reduces the blocked pores, that means gives you clarity of the pores. Third, it is used for reducing brown spots. Fourth, it's used for pigmentation. It gives and reduces whole lot of pigmentation in the skin, and that's how it gives you an even complexion, even looking skin tone. Fifth, it's used as an anti-aging. So retinoids are known to renew the cells and build up whole lot of collagen and elastin in the skin and gives you a more firmer, tighter and more youthful looking skin. So in high concentrations it has usage in acne, but in lower concentrations, in very low potency drugs, it can be used for reducing the lines and wrinkles around the eyes as well. So how do we use retinoid? Now retinoid is a night drug only. That means never in the morning because it is photosensitive. So also you prepare your skin before starting the retinoid on your face. So you start using a face wash which is a calming and a soothing one. Don't use a face wash which has salicylic or a glycolic or a peeling or a irritating ingredients. Use a calming and a soothing face wash. Post that, put a moisturizer. Moisturizer has to be applied all over the face, massage and left for good 10 minutes so that the skin is more soft, and it also helps in absorption of the retinoid well into the skin, and it also counters the drying effect of the retinoid. Next, start with the retinoid because it's a very cautiously used drug. You use only in the form of small dots all over the place and then lightly massage it for maybe 2 to 3 minutes, let it get absorbed and keep it overnight. Next day morning, wash it off again with the face wash and protect your skin with a broad spectrum sunscreen because it's a photosensitive drug and we do not want any environmental pollutants or sun to be coming into the little bit of the dryness which the retinoid usually causes. The regime will be use it starting only 2 times a week, only twice a week guys. See for any signs of any irritation. If you're fine, then you can step it up to 3 times a week and then continue for good 3 to 6 months. So the idea is to get your skin more tolerable to the retinoid. Let it take its own time to settle and accommodate the retinoid well in your skin. That's why the underlined word is only 2 times or maximum 3 times a week. So while you are on retinoids, I will curtail down, or the doctors curtail down on other active commonly used anti-aging ingredients or antioxidants like vitamin C, glycolic acid, ferulic acid, and azelaic acid. So we curtail down the frequency of these so that counter reaction between the retinoic and these drugs is not there, and the retinoic absorption and your tolerability into the skin is much better. So if you're a beginner, start with a low concentration, step it up slowly, and work it towards 3 to 6 months so that you see the best of the results: even tone, tighter, firmer, youthful looking skin. Do not use when you are pregnant. Do not use when your skin is dry, when you have a flaky dermatosis or any other irritant on the skin. So take home message: if you're looking for a very great looking skin, good texture, shiny, tighter, firmer, even complexion, then retinol based formulations can be one of your skincare regime. But ask your doctor how to begin, how to start, so that you have all the instructions in your list and you follow them. Like I said, go patient, go slow. Never use it in the morning, but in the morning still you have to use a calming face wash, moisturizer, and a sunscreen, and at night a good moisturizer and then a retinoid based cream. So these are the advantages. This is what retinoic is. It's vitamin A derivatives. It does great to your skin and it works wonders. So many of these over-the-counter night creams, which are from these big brands, have anti-aging night retinol creams. Please take your doctor's advice to choose which one would go with you, which one you can start with. Start with a low concentration and then potency, and then go up and build it up as your skin gets used to it, and that's how you get the best of the results. So we'll be back with more such beneficial information on other topics. So take care, stay glowing. Thank you.